On something like the Basti Dravya do have the therapeutic property in a local action. Once it is being considered the Vata Sthanam, it is going to have its effect all over the body. So this is another example wherein I had a case of bilateral intraventricular bleeding in the brain of a neonate of 4 days, a very young child wherein the reflexes were being altered, possibly it was a birth injury or something like wherein he had a sort of a hematoma, and the size of the hematoma was quite big enough, and compression effect was being observed in the child. And the size when it was being for investigation, it was somewhere around 9:7 and 8:6 was the size of the hematoma. And the parents were not willing for going for a craniotomy or surgical removal of the same. So what we have done is we have given this in the form of an enema. Very small concentration was being given through the Ryle's tube as well, but we have given it in the form of, because even giving it in the form of a regular enema is quite difficult. It's a newborn child, so it was very difficult to tackle. But the reports of the patient was really amazing to see, like the patient started to improve, the hematoma or the bleeding spot started to resolve, and also it started to diminish eventually. So every 5 days or weekly once or twice the scanning of the brain was being done to reassess the hematoma, and every time it used to turn smaller and smaller. It turned out more hypoechoic, means there is a radiation which has been passed, means the opacity is being reduced, the condensity of the hematoma size is being reduced, and it started to resolve it. And eventually it came out to be almost like 2 cc in size measuring. It turned out to be very much normal, and the hemorrhage was being resolving. Later on, the child reflexes started to resolve as well, like the Morse scale, or you have the sucking reflex. Everything started to resolve back in the child. There was no abnormalities observed. No craniotomy was being carried out. And later on, the size of the hematoma was also significantly improved. The child ultimately survived. That's a most important phenomenon. Similarly to that, you can go for the other therapeutic properties other than the Basti, where you can go for the Nasiya karma with the drugs like Shwasakutarras is direct reference from the textbook, where it is being explained as the method should be given in the form of a Nasiya karma. So either of the techniques can be adopted. But Rasushadhi in the form of a Nasiya is also comparatively very less into the clinical practice in many zones. But it is really therapeutically active in case if it can be administered. One such reference is Shwasakutara Rasa from 𝐻𝐵 Ratnavali, or any of the textbook where he explains the method of Nasiya with it. So the Rasushadhis, once you have given the Shodhana and Shamana Chikitsa, there are Rasushadhis in asamyak kriya, vyapats of Panchakarma. Sometimes it happens like even with the great precaution, the patient might turn up into the vyapats of the Panchakarma, Vamana Vyapat, Basti Vyapat, or Virechana Vyapat, anything like that. So in those conditions where the person also can be treated with any of the Rasushadhis. So significance of Rasushadhis, especially in the Durbalavastha. Why I say Durbalavastha is Samyak Vamana Lakshana or Samyak Virechana Lakshana, you find Durbalata is a essential component. The person turns out to be a bit weaker immediately after Vamana and Virechana. It is a Durbalavastha. And whenever you have such a Durbalavastha, Ashtanga Sangraha Uttarasthana, Acharya has explained us to give certain drugs which can be given during this period. I many times start these basmas or these preparations on the day of Vamana and Virechana as well. Like you have Shilajatuk, Shaudra, Vidanga, Sarpi, Loha, Abhaya, Parada, Tapya, Bhakshaha. Apurayet Durbala Deha Datun Tri Pancha Ratrena Yata Shashankaha is a reference from Ashtanga Sangraha. So these drugs can be given in all the Durbalavastha of an individual, including the post-Panchakarma therapeutic situations, because where it is being explained, Swalpa hi matra vipula gunaschaha, sadyo hi tad deepana pachanam cha. So this is a reference from Rasendra Chudamani, where he explains that immediately it is going to do the Deepana Pachana. Sadyohi tad Deepana Pachanam. It is going to show its action as Deepana and Pachana instantly and immediately. So by this what happens? The person's Agni is being again re-stimulated. It is been well maintained or well normalized, because during the Panchakarma there is an alteration in the Agni there. There is a sort of a physical exertion in an individual, and the patient has gone the Shodhana therapy because he is having some abnormality. Abnormality in the sense of some vitiation in the Agni level, some vitiation in the Dhatu level. Agni don't ever take as only Jataragni, it could be Bhutagni and Dhatu Agni as well. So this is an important phenomenon, Tad Deepana Pachanam. So many times I will say the treatment protocols are very much important, and it are to be taken wherein you can maintain the Agni, Deepana and Pachana qualities, by which the person can be converted into a strong personality, including the strong Agni, by which the Doshic levels and the Dhatu levels turns to be a normal or balanced in equilibrium. That is the Swastha Lakshana. Similarly, whenever you have the patient wherein he has a Vyapats, like he has excess of Vamana, then you can give this set of drugs like the Vamana Hara substances which are being claimed by the various textbooks, like the Kantaloha Basma, Shrotanjana, or you have Sauviranjana, Vanga, Panna, Pusharaga, Rajavarta, Gunja, Ahifena, Gairika are being explained as a Vamana Hara. The person's Vamana is not getting controlled. So these drugs can be given to the patient to control it in case if the focus of the Panchakarma is excess. And Visha Doshagna, because the medicine whatever you have given, might be it is Madanaphala or Ichabedi, whatever you have given, if it is working in excess and making the patient to turn more and more weaker, I name it as Visha, because it is an unwanted substance in the body now. It is causing problem to an individual, because the assessment of the Sharira Bala or the Agni Bala of the patient was not properly established, by which the person has landed up into this particular condition. So on that grounds, the Visha Doshagna substances like Abraka, Vaikranta, Makshika, Tutta, Karpara, Gairika, Gandhaka, Kasisa, Spatika, Haratala, Manashila could be given to the patient to reduce this Vishatva. Certain times it happens like a patient has taken the Vamana and Virechana Dravyas, but he did not achieve a classical Vamana and Virechana. There is some amount of drug which has been left out in the body, or total Shuddhi is not been achieved in an individual. So even in those people, to digest the Avashesha Aushadha which is given already for conducting the Shodhana Kriya, can be neutralized by giving such drugs as Visha Doshagna set of drugs. Similarly, you have the other set of drugs from this category as a Sauviranjana, Srotanjana, Rasanjana, Anjana, Swarna, Rajata, Tamra, Mukta Basma, Kantaloha. They can be given for the patient to see that the Vishagna property or the Avashesha doshas which are being left out in the body are also to be ruined off, or else it's going to form a new disease. It's going to evolve back into the patient's body in the form of a new disorder. That should not happen. So similarly, you have the drugs like Pravala, Panna, Pusharaga, Pairojaka, Shanka, Khatika, Tankana, Gunja, Snuhikshira, which can also be given to reduce the toxins in an individual. And once you have achieved to this state, then you can go for the Rasushadhis in the Paschat Karma of the Panchakarma. One thing is during the Samsarjana Krama, that is immediately after the procedure. The another step is after Samsarjana Krama, once the total incidence of the Samsarjana Krama is accomplished successfully. So these are the two steps where the Rasushadhis can be taken into the study. During the Samsarjana Krama, administer the Rasa drugs as per the clinical indications in normal dosage form based on the Doshic levels. Normally, the medicines are said to be contraindicated immediately after the Shodhana Kriya, just because of the reason the Agni is not set back to its normalcy. You give him some Chaunaprash, you give him some Leha Kalpana, you give him some Aushadas, which the body's Agni is unable to digest it, because it's not yet established back to its normalcy. So in those conditions, you need not think about this particular protocol for administering the Rasushadhi, just because of the reason अल्पमात्रस्य उपयोगित्वात् अरुचेर अप्रसंगत्वात् क्षिप्रम आरोग्यदायित्वात् औषधेभ्यः रसः. It is very small dosage form. You are giving 65 milligram, you are giving 125 milligram, which is a very small dosage form, and it is having quick response in an individual, and it itself is Agni Swarupa. Because you have given so much of Putta Samskaras, it is having Agni Tulya Gunas within it. It doesn't need much of the Sharira Agni, or doesn't need much of the Sharira Jhataragni to digest it and send it for the metabolism factory in the body. So instead you can give this Rasadraviyas, which can act excellently in those clinical pathologies wherein it can be manipulated with the Doshic levels and normalize it in case if you have the avashesha doshas left out in the body after the Shodhana Karma in set of the Panchakarma procedures. The Deepana Pachana set of drugs can also be administered during the Samsarjana Krama, because the Agni is to be maintained well, so that you can add up the more treatment protocols to the patient eventually. So they are the Deepana and Pachana set of drugs like Abraka, Haratala, Swarna, Mandura, 𝐂𝐚𝐠𝐞, ಮಾಣಿಕ್ಯ, ಮುಕ್ತಾಪಿಷ್ಟಿ, ನೀಲಂ, ವೈಡೂರ್ಯ, ಪೈರೋಜಕ, ಗೋದಂತಿ, ವಿಷತಿಂದುಕ, ಗಂಧಕ, ಅಗ್ನಿಜಾರ, ವರಾಟಿಕ, ತಾಮ್ರ, ಕಾಂತಲೋಹ, ವಂಗ, ನಾಗ, ವರಾಟಿಕ, ಪ್ರವಾಳ, ಪನ್ನ, ಪುಷ್ಯರಾಗ, ವಜ್ರ, ಗೋಮೇಧ, ರಾಜಾವರ್ತ, ವಿಷತಿಂದುಕ. And the set of drugs into the Pachana category or the Gandhaka, Navasadara, Varatika, Hingula, Vanga, Pravala, Pushyaraga, Gomeda, Rajavarta, Vishatinduka. And these drugs being Deepana and Pachana, I'll say the whole index of Rashastra is covered in Deepana and Pachana almost, just because of the reason wherever you give the Putta Karma, the Agni Tattva has become an inbuilt quality in that, and it is definite to show the Deepana and Pachana in an individual. And added to that, whenever you find the specific doshas in an individual are still present in the patient, or where the person was been suffering till now, for which you have conducted the Shodhana, then antagonistic to those doshas can be given now as a treatment protocol. You have a set of drugs as a Vatagna set of drugs for the Rasushadhis in Panchakarma practice can be adopted, wherein in the Samsarjana Krama, wherein you can give the patient with that specific doshas for which he was suffering from. In case if it was a Vata Vyadhi, you can ask him to take the drugs like Haratala, Manashila, Swarna, Rajata, Kantaloha, Vanga, Naga, 𝐂𝐚𝐠𝐞, Godanti, Gomeda, Rajavarta, Tankana, Vishatinduka or Snuhikshira, which acts as Vatagna. In case if it is Vata, Pitta, Kshayagnas, then you need to give the drugs like Abraka, Vimala, Tutta, Rasanjana, Rajata, 𝐂𝐚𝐠𝐞, Manikya and Gunja. In case if you want to reduce the Pitta in an individual or the Pitta dosha in an individual, you need to give him with that of the Gairika, Haratala, Shrotoanjana, Kampilaka, Hingula, Rajata, Tamra, Kantaloha, Varatika, Vaidurya, Rajavarta, Chandrakanta, Spatika, Dugdha Pashana and Katika. In case if you want the patient to have the Kapha Vata Hara, then Kasisa, Murdharashringa, Gauri Pashana, Manikya, Pravala, Pushyaraga, Vaidurya, Suryakanta, Rajavarta, Tankana, Langali, Jayapala, Ballataka and Vatsanaba could be the choice of drugs. In case if it is Kapha Pitta Hara, then Manikya, Tutta, Kaparda, Karpara, Srotanjana, Sauviranjana, Hingula, Tamra, Kantaloha, Jasada, 𝐂𝐚𝐠𝐞, Mukta Shukti, Gomeda. And in case if it is Kapha Rodhaka, where you want to block the Kapha there, being Utklesha state, then you can give the drugs like Abraka, Gairika, Haratala, Manashila, Rasanjana, Sroto Anjana, Kankushta Kampilaka, Murdharashringa, Rajata, Tamra, Kantaloha, Vanga, Varatika, Shankha, Katika, Tankana and Vishatinduka. So these could be the set of drugs which can be given in various stages of the illness based on the Doshic configurances and that of the Rasaushadhis. In case of after Samsarjana Krama, you have to give the set of drugs related to the Rasayana and Vyadhihara Chikitsa, that is Karmanusara Chikitsa, where you have specific to Vyadhihara property from the individual chapters of the Rasa Shastra based on the disease profile can be taken, selected, opted and given to the patient as Vyadhihara Chikitsa. Rasayana set of drugs are however being explained in the textbook, and they can be given in most of the patients like wherever they adopt, they would like to adopt the Rasayana Chikitsa with the Makshika, Vimala, Shilajatu, Tutta, Gandhaka, Haratala, Manashila, Neelanjana, Kankushta, Hingula, Swarna or Rajata, Kantaloha, Vanga, Manikya, Vajra, Rajavarta, Suryakanta, Ballataka, Vatsanaba. and Vaikranta, Makshika, Manashila could be the Rasayaneshu Sarveshu or Rasayana set of drugs which can be given in all the patients wherever you would like to give him with a Rasayana therapeutic properties. Vyadhiharana Chikitsa should be specific to the Rogavata Chikitsa or Shamanaushadhi drugs can be selected from the individual chapters of the textbook of Rasa Shastra and can be given to the patients wherever you need the Vyadhihara Chikitsa. The probable mode of action wherein the drugs can be seen, whether you give it in the form of an enema for the Vamana or the Virechana or either. The textbook of Anandakanda speaks about Sa Rasah Kramate Dehe Siddhaya Sambhavantihi Rasayane Tu Yaha Proktaha Mulika Deha Siddhidaha. So once it is being given, just like a oil dropped on water, it spreads all over. Similarly, the drugs which are being given to an individual spreads all over the body. Kramate Dehe. Then it shows the Siddhaya Sambhavantihi. It shows us the Siddhi in an individual. It shows us a normalness in an individual. It shows a benefit in an individual. Then Rasayane tu Prokta Mulika Deha Siddhidaha. Then it is Rasayana in action. But in case if you want to have the Deha Siddhi, the Rasaushadhis when it is being mixed up with the Mulikas or the herbal drugs can show the Deha Siddhi in an individual. So this is an excellent response where we can see. So to be in a gist, to say in the Purva Rupa Avastha of the Shodhana Karma where we have given the dosha Utkleshakara Bhasmas to an individual to increase the respective doshas in an individual. Then later on we have given the Snehana and Svedana to the patient with the Rasaushadhis in the form of a Bahir Parimarjana Chikitsa. Then later for the Vamana Virechana Basti or any of the Shodhana Kriyas, we have adopted the drugs for the Snehana and Svedana for the Basti and all. And through them we have channelized, we have given the drugs of the Rasaushadhis into the Panchakarma practice in the form of a Vamana Dravya, Virechana Dravya and Basti Dravyas or the Nasiya Dravyas, either of the formulations. Then later on once the person has landed up into Vyapats in case, then to reduce the Vyapats or to arrest the vitiated doshas, again we have a set of Rasaushadhis which were being enumerated. Then later on we have tried to see like the Agni of the patient is definitely to be concerned at a prime outset, and we have given him a set of drugs as Deepana, Pachana and all, wherein it will saturate the Agni including the Jataragni, Bhutagni and Dhatogni at an outset. Then later on during the Samsarjana Krama, we need not wait for the Samsarjana Krama to end up. Instead the Rasaushadhis can be given during the Samsarjana Krama as well to see that he gets a maximum benefit to achieve the best of the therapeutics of the Rasa practice. Then later on after the Rasa Samsarjana, then we have given the drugs of the Rasayana or Vyadhishamana property. Rasayana for the normal individual wherever you want to achieve a normalcy of Rasayana property, or the Vyadhishamana drugs where it can be selected from the individual chapters of Rasa Chikitsa and can be established. So these are the various forms of how the drugs at different levels of the Panchakarma practice, the Rasaushadhis can be attributed or they can show their significant role. Basically, Panchakarma itself is one such treatment modalities of Ayurveda which is a very strong weapon for the clinical practice to ward off the various disorders in an individual. But in case if it is been fortified with the Rasaushadhis of these kinds in this particular format or the protocols, then you can see the best protocol what you can see in an individual. So this is all what we can appreciate. So to just up once when we see about these particular concepts of the Panchakarma practice, it is very much important for us to note even about the concept of the Panchamahabhutas. Most of these targets of the body are through the Jaliyamsha. We have given Vamanopaga, we have given Virechana. Through the liquid media we are trying to remove the doshas. And we need certain substances which can alter this. They should have that inbuilt qualities within the drugs like the Rasaushadhis, which are basically made up of the Prithvi Mahabhuta because they are found in the earth crust and they are named as the heavy metals. So they are himself having a sort of a Prithvi Tattva and Jala Tattva. Then later on with the Agni Sanikarsha we have included lots of Agni Guna within it. And of course we have treated it with n number of Putta Samskaras by which you have given a sort of a Akashya Tattva within the drug. And based on this particular phenomena, the drug has attained a sort of a Prithvi up, Tejas, Vayu and Akasha gunas. All the Panchamahabhutas are being attributed samskaram gunantaradanam. Certain gunas which are being achieved by its origin in the earth crust, certain gunas during the shodhana, certain gunas during the marana, certain gunas during the anupana, certain gunas in the formulation where you combine many drugs and it is being given, certain gunas once it is being given with anupana or the way of the treatment protocol, or it is being given to the person in respect to the Aushadha Sevana Kala to target the specific type of the doshas in the body, as claimed by the textbook as Yunjadadannam Annadam Madhyante Kavalantare Grase Grase Muschannam Nishisha Aushadam. Of course, any of the references like Aushadha Sevana Kala can be taken, and accordingly it can be taken into the practice by which you can target much of these disorders. The most outfit, the way how we can target more is through the Jala Tattva. Just because of the reason the body is made up of at least 72% of water, 12% of the Prithvi Tattva, 12% of Prithvi Tattva, 72% of the Jala Tattva within the body, and hardly 6% we have of the other phenomena. Of course, I don't deny the importance of the other Mahabhutas, but through the Jala media, in the form of Vamana, it is a Jala Rupa which is coming out. In the form of Virechana, it is a form of a Jala Rupa which is coming out. In the Basti also, it is a sort of a Jala Rupa which is coming out. In the form of a Nasiya or the Mokshana, Rakta Mokshana, everything is a form of a Jala Tattva. Everything is in the form of a Jala Tattva. So try to target the Jalamsha by which you can detoxify the 72% of the body. So this is one such ideology. It's one such ideology by which through means where you can detoxify the body at a higher extent, at a very convenient extent, where we can give the best to the patient. It's not about a particular phenomenon or a method of principles. It is one such attitude how we can develop or modulate the science as per the present day requirement or the way how we understand the science. I am utilizing all these Rasushadhis basically into all my Panchakarma practices in my routine clinical protocols. I am using it in Vamana, I am using it in Virechana, I am using it in Basti, everywhere. In all sets of treatments, I am using the Rasushadhis. I am finding an excellent response in an individual. I do find many times they have a tremendous response even in emergency practice. Certain times I do give this Rasushadhis in the form of sublingual tablets, mainly the Pottalikalpanas. I extensively use lots of Pottalikalpanas into these protocols of the Panchakarma practice. And even those things I give it in the form of a sublingual tablets, which can be given as a long-term quick response therapeutic mode of actions, which can be seen in most of these patients. So these are a few of the phenomena where we need to understand for the Rasushadhis into Panchakarma practice, and that's what we need to understand with the protocols like this is Rasa Chikitsa into the Panchakarma, where it can be analyzed or understood or can be adopted into various sects of the clinical practice.